I'd like to introduce Dr. Paul Sternberg, Jr., who is the Chairman of Ophthalmology at the Vanderbilt Eye Institute, as well as our current President of the American Academy of Ophthalmology. Thank you so much, Dr. Sternberg, for coming to talk to our students today who have a lot of questions about whether or not ophthalmology is the right field for them. And I just want you to give us a little insight about your personal experience and how you have seen the field change over this past several years.
Well, thanks, Dr. Singleton, for inviting me to talk with you and to your students. It's certainly a subject where I'm very passionate. Ophthalmology is an amazing field, and I'm fortunate that it's been part of my entire life. My father was an ophthalmologist, and in fact, I had an uncle and a cousin who were ophthalmologists, so it really is part of my DNA. I became an ophthalmologist not because it was necessarily the family business or because there was pressure imposed on me to do it, but because growing up, my father was excited to go to work every day and would at night at dinner talk to us about the interesting patients he met, the challenging problems he was taking care of, and the real reward that he felt because he was helping people. That sight is a valuable sense, and restoring it is an exceptional privilege. It's also been amazing to watch the field evolve over the years. When I think even back to my training, the things I do today in my day-to-day practice are vastly different than what I learned 25 years ago. And when I think back to how my father cared for his patients, it's almost like he was in the prehistoric era. The sophistication of our microsurgical techniques, the lasers that we use, the amazing biologics, the development of specific drugs to treat conditions that we thought were not treatable, and then the horizon with artificial vision, with stem cell therapy, regeneration of neurons. So this is a field where it's rapidly evolving. We're rich with innovation, with technology, but at the same time, we also touch patients, and we see them from their youth. We take care of babies that may be born with congenital eye problems, to people in their 90s or even older, where their independence and their quality of life is being impacted by cataracts or glaucoma or macular degeneration, and we can help them. We also, though, see the tragedy when we can't help them, when there are conditions for which we don't yet have treatments, and they have to stop driving or they have to go into assisted living, not because they've had a stroke or because they've had a heart attack, but because they can't see. And so there's still that rich opportunity for what you may be able to do in your career that Dr. Singleton and I have seen in ours, to take our field that one extra step, where there's another disease where we figure out an effective treatment and prolong that precious sight for a further period of time. So I still am excited about the field. I love coming to work each day. I love even though my clinical time is limited, it's the highlight of my week. Seeing my patients, touching them, helping them when I can, being compassionate when I can't. And we need young people to continue to enter the field. It's with your energy and your creativity, your innovation, that we're going to continue to be the special field that we've been. We need people from all backgrounds. The world is changing, and we need individuals that can relate to the vast landscape of our world, of our culture. And we welcome you into our profession, and hope that you'll share the same excitement every day that Dr. Singleton and I do.
Do you have any piece of advice for these students that are trying to excel academically and get into this field? Because it is a tough specialty to get into.
It is, and I think we like that because it means that the people that do enter our field are the best and the brightest. The most important thing is to do well in school. I mean, to perform well. That requires commitment, and it is not something that just happens. So a good work ethic is the first thing that we really look at. You need to be reliable, conscientious, dependable. But we also like you to find the ability to kind of expand beyond the classroom. The classroom performance is the core, but we do want people that have interests and experience beyond the classroom that want to help others, that are involved in community activities, extracurricular activities. That some of the greatest talents that have entered our profession were athletes that performed well at a high school or college level, or were musicians that showed that discipline that's required to excel, so all those things contribute to who you are and will make you both a better doctor, but also a better candidate to enter our field.
Thank you so much, Dr. Sternberg, for your time. I know our students are just thrilled to be able to have the opportunity to hear you give insight about the field, so thank you again. And hopefully our students will just be lining up to give you a call and find out more information about how they can enter into ophthalmology. Thank you.
That would be great. Thanks for the opportunity to talk to you.